Good afternoon, everyone, and good morning to those on the West Coast. My name is Kimberly Fowler, and I am the Director of Technical Assistance and Research here at the National Council of Urban Indian Health. Thank you for joining us today for this Community of Learning webinar on Health Impact Assessments, also known as HIA. Before we get started, I would like to go over a few housekeeping points for you all. I ask that if you haven't already done so, please provide your name and organization in the chat box located in the lower bottom of your screen, just so that we can understand who is in attendance. And also, if you would like to view the presentation in full screen, there is an option to select the 4 arrowhead at the top of your screen in order to create a full screen mode for you to view the presentation. All lines are currently muted. However, if you wish to ask a question, we ask that you place them in the Q&A pod on the lower right-hand side of your screen. We'll provide time for Q&A at the end of the presentation, and we look forward to your questions. So without further ado, I'd like to, and I'm sorry I didn't show you this slide, but just if you would like to ask any questions, please feel free to place them in the Q&A pod. But without further ado, I'd like to introduce today's presenters. First, we have Ms. Bethany Rogerson, who is the manager at the Health Impact Project and has worked with the project since its start in 2009 and currently supports HIA program grantees in efforts to build the infrastructure, systems, and funding mechanisms to sustain routine consideration of health in decision-making. Bethany will be joined by Ms. Amber Linhart, who is a senior associate with the Health Impact Project and joined the project in 2013 after completing her master's degree in public health at the University of Washington. So welcome to you both, Bethany and Amber. But before we move into our presentation, I would like to once again remind everyone that you are in listen-only mode, and if you would like to ask a question or make comments, please place them into the Q&A pod at the lower bottom hand of your screen. So Bethany and Amber, I will now turn it over to you.
Great, thank you, Kimberly, and thank you to NCUE for the opportunity to present today. And of course, thank you to everybody who's on the phone for taking the time to join and listen to our presentation. We hope you'll find it useful and interesting. My name, as Kimberly said, is Amber Linhart, and I'm joined here by my colleague Bethany Rogerson. And Bethany and I work with the Health Impact Project in collaboration, the Robert Wood Johnson Foundation, and the Pew Charitable Trust. We're based in Washington, D.C., and we're a national initiative to reduce health inequities and improve the health of all people by ensuring that health is a valued and routine consideration in decisions affecting them. And I apologize, I have a bit of a cold, so that's why I sound funny. So today we're talking about Health Impact Assessment, or HIA, which is one way to bring health considerations into decisions about policies and programs in sectors other than healthcare. This presentation will include an overview of HIA, including brief summary of the HIA process and the time and resources involved in conducting HIA. I'll provide some quick examples of HIAs and the types of decisions that have been informed by them. And then we can have a discussion about the ways that urban Indian health programs and tribal organizations and other partners can collaborate on or increase capacity for HIA. And then we're happy to answer any questions that you might have, and we also have some discussion prompts in case you don't have any questions for us. Our work is focused on addressing the social determinants of health. And as you all know, there's an established and growing body of research that shows that health doesn't happen in the doctor's office. Rather, it's where we live, work, and play. Things like access to healthy foods, cultural activities, healthy housing, and built environment infrastructure that supports safe physical activity all have very real impacts on health and well-being. And here's another way to think about the social determinants of health that is probably familiar. The outside ring of this rainbow or onion slice represents conditions such as socioeconomic status, cultural and environmental conditions, and larger social conditions like racism and segregation that influence where people live, the types of jobs people have access to, educational attainment, diet, and other factors that ultimately lead to health outcomes like stress and disease. So we know that things like our economic stability, educational attainment, social and community context, and the built environment where we live, work, and play the outside ring on that diagram from the last slide, all impact our health. The problem we encounter, though, is that so many policies are made outside the health sector that can have significant health implications that go unrecognized because health isn't on the minds of policymakers. So Health Impact Assessment, or HIA, attempts to correct that problem by asking how might some decision impact those social determinants of health? And based on those changes in determinants, what health outcomes can we predict? And then, what recommendations can we make to maximize positive outcomes while ensuring that any unintended harms are minimized? The formal definition of HIA is that it is a structured process that uses scientific data, professional expertise, and stakeholder input to identify and evaluate public health consequences of proposals and suggest actions that could be taken to minimize adverse health impacts and optimize beneficial ones. So just to summarize some key points about HIA, it is a structured process, and I'll go over the specific steps in just a moment, but it's flexible enough to be applied to a variety of scenarios, as you'll see in a few slides when I talk about examples. And HIA makes predictions about health implications of a pending decision about a policy, project, or plan in order to identify health impacts, many of which are often unintended. And then by identifying those health impacts before a decision is made, we help policymakers weigh trade-offs and understand the health impacts of their work. And once we've identified those predicted health impacts through scientific research, stakeholder engagement, and community involvement, we make recommendations to minimize potential harms and maximize health benefits. So as I mentioned, HIA is a structured process, and these are the main steps of an HIA. Screening is the first step, where we identify an upcoming policy decision and decide whether it would be appropriate to apply an HIA. Again, HIA looks at pending decisions outside of the health sector, so we might think about whether there are any upcoming planning decisions, budget changes, economic policies, or other pieces of legislation that might be coming up. If an HIA seems appropriate, and if we have the necessary resources to move forward, we can enter scoping. And in scoping, we start to think about the scope of the research in terms of potential health impacts and the populations who experience those impacts. In assessment, we look at epidemiological studies, conduct literature reviews, maybe do primary data collection through surveys or qualitative data gathering like focus groups, all in order to make predictions about the potential health impacts of the policy decision under analysis. And then based on those predictions, we can make evidence-based actionable recommendations for policymakers on ways they can minimize any predicted negative health impacts and maximize health benefits. We then ideally monitor the situation to see if we've had any effect on policymaking and whether health improved as a result. It's important to note that stakeholder engagement, that is, engagement with affected community members, decision makers, and other key partners, is essential at every step of the process. I should also note that while I've arranged these steps in sequential order, it's really an iterative process, and these steps often blend together or get repeated in some order. And I mentioned that in that first step, screening, we move forward with HIA only if it seems appropriate for the decision that we want to analyze and if we have the necessary resources. So you might be wondering what kind of resources are involved in doing an HIA. So first is capacity. It's helpful if you're going to undertake or participate in or help with the health impact assessment to have some understanding of social determinants of health. It's also helpful to have capacity to conduct research, whether it's literature review or obtaining or analyzing health data or looking at epidemiological data or studies. But you can also always pull in subject area experts. We've seen some folks do that. For example, if you want to be able to collect data on air quality, you might reach out to somebody who does air quality monitoring. And then it's also helpful to have familiarity with the policymaking process. So you understand the timeline under the decision will be made and the points when you could actually inform the decision makers. It's also helpful to have funding to do health impact assessment. And the cost of HIA really varies. We see people in health departments, for example, do health impact assessments with no funding at all. And then we sometimes fund comprehensive health impact assessments for anywhere from $75,000 to $100,000 or more, but they can certainly be done for less or for much, much more money. And then the timing of HIAs, how much time is required, also really varies. It's a spectrum, really. There's what we call rapid HIAs. They can be done in weeks to months. They're typically smaller. They look at smaller, less complex decisions. The assessment phase is generally limited to literature review and descriptive analysis. And we also call rapid HIAs desktop HIAs because they really have little public engagement. You can basically do them at your computer. At the other end of the spectrum are comprehensive HIAs. They can take anywhere from a year to 2 years or even more. They look at more complex decisions that typically have lots of different potential ways that they could be impacting health. Assessment in a comprehensive HIA would probably include some level of primary, quantitative, and qualitative data collection and much more thorough stakeholder and community engagement than what you'd typically see in a rapid HIA. And then just one more note about timing is that just because rapid is faster doesn't mean it's necessarily any less resource intensive than a comprehensive HIA. So it might be helpful to think more about these in terms of examples. I'll run through a couple quick ones and then I'll expand on one that I had experience working with just for more of an illustrative example. So these are some of the types of decisions that you might consider doing a health impact assessment to inform. One example is legislation. So an example of a legislation-related HIA is that we had a grantee from our project who conducted an HIA on funding for full-day kindergarten in the state of Nevada. And what they found in their HIA is that kids who attend full-day kindergarten typically score higher on third-grade reading and math standardized tests, which they found correlates with increased graduation rates and ultimately greater academic achievement. And lifetime academic achievement is associated with higher socioeconomic status and improved health outcomes. In addition, kids in full-day kindergarten would have increased access to school-based programs and services like hearing screenings. And so in that situation, ultimately there was a budget decision to fund universal full-day kindergarten in the state of Nevada, which was a pretty big win. So that's an example of how you might apply an HIA to legislation, as well as an example of some of the types of health pathways that we would consider in an HIA. You can also do health impact assessments on project-specific decisions. So an example would be one of our other grantees did an HIA regarding the building of a new natural gas power plant in New Orleans, in East New Orleans, and considered the ways that construction activities and ongoing air emissions and groundwater use of the natural gas plant would have impacts on health. You can also do HIAs on planning decisions or comprehensive plans. We had a grantee work with a pueblo in the Southwest on some planning decisions related to rehabbing adobe homes and developing an economic center of the pueblo. And then you can also even do HIAs on implementation. So the key point that I was hoping to make earlier was that we do health impact assessments on pending decisions. You do your HIA before the decision has actually been made, but there can be opportunities to inform a decision after it's been made if you can inform the implementation. So an example of that is an HIA that I helped work on in Seattle back when I was at the University of Washington. And the topic there was the implementation of a plan to clean up a Superfund site. So I'll just walk through the way that we did that HIA to just illustrate more how the various steps work and the types of information that you might obtain in an HIA and how you would use it. So in Seattle, there's a river. I know there's at least one person on the call who's from the Seattle area, but the Duwamish River goes through South Seattle, and it's one of the most contaminated places in the nation. It's on the Superfund site list, and the EPA had crafted a plan to clean it up. This cleanup, we realized, would affect 2 federally recognized tribes who have treaty rights to the river, as well as the Duwamish tribe, which just had historic access to that area. And then Seattle also has a large urban American Indian and Alaska Native population who could potentially be affected by this proposal to clean up the river. So first we did screening, or that's the first step of HIA, and we asked ourselves, is HIA a good tool to apply in this situation? And we realized that there was going to be an opportunity to inform the cleanup plan. The EPA would have an open comment period, so that would be our chance to share our recommendations from the HIA. And then we also had the resources to move forward because we had a grant from the Health Impact Project actually to conduct this HIA, and we had lots of student and staff resources to carry it out. So we moved from screening then to scoping, where we thought about the populations who would be potentially affected by the cleanup. I mentioned the two federally recognized tribes. Also, there were residents who lived on either side of the river, and then people who traditionally used the river for fishing, which included a lot of urban populations like low-income, food-insecure families who fished in the river to provide food for their families. And then also we found out that some urban American Indians and Alaska Natives were fishing in the river for cultural and just family reasons. Scoping is also, as I mentioned, where you think about the health impacts that you might need to assess. And we realized that although they were cleaning up the river, there would be potentially continued contamination, and that people who continue to use the river or consume fish and shellfish would still be exposed to contamination. Also, the construction activities during active cleanup and ongoing shoreline restoration could have health impacts, whether through exposure to traffic or emissions from vehicles and barges, or even through gentrification as the shoreline was restored and housing prices increased. We realized also that there would be an interruption in people's ability to fish, which would, while it would potentially protect them from eating contaminated fish and shellfish, if they're fishing for cultural and traditional reasons, there could certainly be health implications from preventing them from carrying out those traditional activities. So then we moved into assessment, where we assessed whether those potential health impacts were likely and how, to what degree people might experience them. We did focus groups, literature review, and collected some primary data. We also wanted to include some demographic data in our assessment, and so we worked with the Urban Indian Health Institute. I know there's somebody on here from the Seattle Indian Health Board, to get some demographic information about just urban American Indians and Alaska Natives living in the area that we could include in our report. So just an example of some of the kind of recommendations that came out of the report. As I said, we realized that there would be ongoing contamination of the river and people would still potentially be exposed if they were to continue eating fish and shellfish from the river. So we recommended for a more strict cleanup that would achieve less contamination after cleanup was completed. We also encouraged the EPA and other decision makers to consider ways to allow folks to continue fishing activities and consume healthful fish and shellfish through other ways besides from the river. We also recommended increased community engagement by supporting and funding local grassroots initiatives that would build social cohesion. And so some outcomes of the HIA that were exciting were that ultimately the mayor announced an opportunity fund of $250,000 to implement some of the HIA recommendations, including bringing the community together to identify ways to improve quality of life and health through the Duwamish River cleanup plan. And then ultimately the EPA also opted for a stricter cleanup of the river. So that's just one very specific and thorough example of how HIA has been used in the past. So next I want to just talk about some quick ways that you can potentially be involved in HIA as an urban Indian health organization or a tribal organization or health department or other partner. You can certainly initiate and lead HIAs on issues that are important within your own community. You can collaborate with partners on various aspects of the HIA. Like I mentioned, we reached out to the Urban Indian Health Institute for data, but there are other examples where tribes or tribal organizations have partnered to help with assessment or do community engagement. You can also participate as advisors on HIA advisory committees, potentially, if there's an organization who's conducting an HIA in your community. I mentioned contributing to stakeholder engagement efforts, whether that's through community engagement or bringing together decision makers. And then there's also an opportunity for tribal organizations and urban Indian health organizations to use the findings and data that come out of HIAs to advocate for policy change locally in your own community. So just to direct you to some additional resources, if you're looking for more information on health impact assessment, our website is healthimpactproject.org, and we have quite a few resources on there, including an interactive map of in-progress and completed health impact assessments that have been done across the country. I think there's over 400 on that map now, so clearly the image on the slide is out of date. There have been quite a few HIAs done in Alaska. I know that there's a few folks from Alaska on the call, and a lot of those have involved tribal organizations or even decisions that would very clearly impact tribes, like mining and oil and gas leasing decisions. So I encourage you to poke around on our website and see if there are any helpful resources on there. You can search through our HIA list to see some of the different types of topics that you might consider applying an HIA to. Some other additional resources that might be helpful are the Society of Practitioners of Health Impact Assessment. The CDC has some useful information on HIA, and then there are some other groups that have some very specific either examples of health impact assessments or resources to help you guide yourself through specific steps of HIA, as you can see on this slide. So that sums up my presentation part of this webinar, and so we would be happy to answer any clarifying questions that might have come in. I think that my colleague Bethany was keeping track of some of those, or Kimberly, maybe you can queue some of those up for us. And then if we get through those questions, we also are hoping to hear back from all of you on the phone about maybe some topics that you know about in your communities that you think that it might be helpful to apply an HIA to. Does it seem like HIA could be a useful tool for you to apply in your community? It would also be great to hear what we, the Health Impact Project, can do to support you or groups like you who are interested in doing HIA for the future. So with that, I think I will pause and see where we are with Q&A.
Thanks, Amber. So this is Bethany Rogerson, also with the Health Impact Project. I have been monitoring the participant chat and Q&A sections. As of now, I just see people's names and affiliations through the participant chat, so would encourage everyone who's joined today to enter any questions into the Q&A section, and Amber and I can field those while we're on the call today. And if you're looking for prompts for those questions, I think the ones on these slides are a great start. We would love to hear from you what your ideas are, what opportunities or challenges you might see, any clarifying questions about how this tool might differ from other tools with similar objectives. So maybe we'll pause for a few minutes as people type in questions, and if we don't see any, I have a couple that I think we can tee up for Amber to continue the discussion. I think one common question that we often get in HIA presentations is whether HIA can be used to evaluate impacts of a decision, or if HIA can be used to bring attention to an issue that might not already be on an agenda. And I think that that might be helpful to talk through. Just thinking about some of the examples that you gave, Amber, I think we really try to stress a sweet spot for health impact assessment in looking at a decision that has already been proposed, as Amber said, and looking for places where there is an opening to weigh in on how that decision will affect health, whether that's positive impacts or potential unintended negative consequences. One additional clarification is that health impact assessment really is not meant to give a thumbs up or a thumbs down to a project, but is really meant to surface and assess the nuances and trade-offs of the decision.
Thank you, Bethany and Amber. This is Kimberly from NCUE. I just wanted to chime in here as well. Thank you all for the presentation. I know that we still have time for questions, and we'll leave that open and available for anyone that may have some additional questions that may come up. I did want to respond to one question that came up that was asking about defining urban. And as the participant has mentioned, there are many tribes that have tribal members living in urban areas. And so in that definition of urban, that's exactly what we define it as. So the National Council of Urban Indian Health represents the 36 urban Indian health programs across the nation that provide essential health services to American Indians and Alaska Natives living off of reservation lands. So anyone that is outside of a tribe or tribal lands living in metropolitan cities, specifically any of the 36 urban areas that are specific to our membership, or any other clinic that provides care specifically to American Indians and Alaska Natives, any of those individuals would be what, as you asked the question, what we would define as urban. However, they are still part of their tribal homelands and are considered tribal members.
Thanks. Sorry, thanks, Kimberly. Well, I haven't seen questions come in, so I'm going to queue up some questions for, oh, here's one. Maybe.
Sorry, and I can read that question for you.
Okay.
Oh, that would be great.
The question is being posed as, how do you determine who to target in conducting the focus groups for the screening/assessment process?
Great question. So first, that's a great that you brought up screening and assessment. So ideally, we're engaging with community members in screening to make sure that the topic of the HIA is actually of interest to the community. It would be even better if the idea for the HIA came from community members. So when we're thinking about who might be affected by a decision, ways to think about who you might need to bring to the table in those discussions, whether it's through focus groups or other community engagement efforts, is really, it's a lot of brainstorming. And then you could look to other examples of HIAs that have been done on similar projects to see who they've included, to think about who in the community might be affected by a decision, and then to also think about who the key players are in terms of decision making, or people who have some either financial or health or other stake in the decision. So those are people that you would want to bring in throughout your project, as I mentioned, in every step of the HIA. I can't see the whole question on here, so I'm not sure that I actually answered it.
If you click on it, it should also open up. But I think you have addressed the question sufficiently.
We also saw a question come in through the participant chat about health in all policies. HIA and HIAP sound similar, not just in their acronyms, but are similar in their activities or goals. We really view health and impact assessment as a tool in the health in all policies toolbox, and one approach to bringing health into decisions made in other sectors. Health in all policies as the kind of umbrella or bigger toolbox has a focus on cross-sector collaboration, on stakeholder engagement, and bringing health to decisions made in other sectors that we know have an impact on social determinants of health. One other thing I would add is that in screening for HIA, if you go through screening questions about whether there is a decision on the table to be assessed, whether there's openness to findings and recommendations from an HIA, if the outcome of that screening process is that HIA is maybe not the best fit, Health in All Policies can provide a helpful framework or set of other tools to infuse stakeholder engagement activities, public health data, to have a health lens in decision making, if not an HIA.
So while we wait for additional questions to come in, I'm going to ask Bethany some questions. But while I do that, I would actually encourage the folks on the call or on the webinar to consider the questions that we've posed on this slide. Can you think of any decisions in your that would be affecting your community that you might want to see an HIA applied to? Or if you think about, if you were to work on an HIA, how would you want to be involved, or what support would you need, or resources would you need in order to do so? Or how could we better support you moving forward? So while you type your responses to that into the chat and Q&A windows, Bethany?
Yeah.
So the assessment is typically a very time-intensive part of health impact assessment, and it's one of the letters in the acronym. Can you give some examples of tools that can help assessment be done in a more structured way, or just some assessment tools that folks typically use?
Sure. So I would say that your plan for assessment really starts in scoping. So oftentimes scoping is time intensive because that's really where you're building your work plan and identifying the issues that are of most concern to stakeholders who will be affected by the decision, and really plotting out the research questions that you want to answer through your assessment. The other point I would make is that the types of assessment tools can really vary based on the HIA team's objectives, and doesn't always mean or necessarily mean that new data needs to be collected. HIA really comes from a perspective of use the best available evidence you have to say what you can about how a decision will affect health. And so that might be a mix of different methods. It might be literature review, it might be focus groups, as someone has mentioned. Amber, I think you mentioned air quality modeling earlier. So depending on what topics come up in scoping, your assessment tools would ideally fit those research questions and their resources and time available to answer them.
And where would somebody go if they wanted to identify, to find some assessment tools that are out there? Are there any good resources or?
Yeah, that's a good question. I think the links that you provided at the end of your presentation are a helpful start. I know Human Impact Partners organizes some of their resources by HIA step. They have a data sources document, for example, in their resources section. That would be a good place to start. I also think searching around completed HIAs in the topic areas of interest would be helpful. So, for example, if you're interested in looking at decisions related to land use and planning or physical activity, you might sort the Health Impact Project map by sector, so look at built environment or transportation HIAs and flip through the assessments or HIA reports linked there. I think you would find assessment tools like walkability assessments like the Pedestrian Environmental Quality Index and other similar strategies to both document existing conditions and predict impact.
As Bethany just mentioned, Human Impact Partners and our website as well have information about that's useful for each step of an HIA. So a question came in, is there an example of an HIA from planning to completion that would be available as a planning and implementation guide? And while I would have to think about whether there is one go-to resource that would really walk you through planning and implementation, I would encourage you to take a look at the resources on Human Impact Partners website. They have their resources organized by step. So in thinking about who are your stakeholders, they have guides on how to do stakeholder analysis and stakeholder mapping, and for example. And then a lot of our grantees, at least, and I think a lot of reports out there, write up their methods pretty thoroughly, either in an appendix or they put it inside of their report. So you could refer to some completed health impact assessments and look for the methods section, and I think you would find a pretty pretty thorough description in there. But again, it really varies whether it's a rapid HIA or a comprehensive HIA, what those methods that they use would be. Bethany, do you have anything to add to that?
I think one helpful resource is something called the Minimum Elements of HIA Practice, which is a resource that should be on SOPHIA, or the Society of Practitioners of HIA website, which is hiasociety.org. I think that's one of their resources you have listed, Amber. As well as several resources that are provide information about planning and implementation of an HIA by step from different perspectives. One is the equity metrics that look at how to or whether you're integrating considerations or addressing health equity issues through your HIA and recommendations on how to do that, as well as stakeholder best practices. So at each step of the HIA process, how can you be weaving stakeholder engagement throughout your approach?
And there are also some good guides out there about budgeting for HIA. So if you have funding to do a health impact assessment and you are in the planning phase, you can look at some of these budgeting resources that talk about how much to budget for stakeholder engagement, community engagement, whether you're doing focus groups or surveys, advisory committee meetings, just really detailed budget guides. And those were created by a community of practice of HIA practitioners who are part of the National Association of County and City Health Officials HIA Community of Practice. That's NACCHO. So if you go to NACCHO, I think it's nacho.org, and find their HIA area of their website, they've got some great resources there on planning and budgeting for HIA that I think are pretty great.
I haven't seen additional questions come in, so I would just encourage anyone who has any outstanding clarifying questions or ideas for potential HIA topics to type them in to the Q&A box, and Amber and I can field those.
Bethany and Amber, this is Kimberly from NCUE again. One topic that I thought about that may have been beneficial to having an HIA may have been the Dakota Access Pipeline, where right now the water protectors at Standing Rock, from the Standing Rock Sioux Tribe, are they're protesting in order to prevent any type of leakage from the pipeline or any type of desecration of tribal lands that are there. And I'm wondering if HIA may have been an example of something that could have been beneficial in the preliminary process when the I guess the legislation was put in place to then develop that pipeline.
Absolutely. I think that Kimberly is a really great example of the type of decision that HIA can be used on. And Bethany, I hope that you have more to add to this too, but a related point that I would make is that in health impact assessments we've seen that have looked at the effects of a decision on tribal members or American Indians and Alaska Natives in general, have considered health in a very different way than what people typically think of health as when we talk about like clinical health, but health from a much more holistic wellness viewpoint, which is how we typically do view health in health impact assessment. So we have seen examples where people have done HIAs that include health impacts related to sovereignty and related to ability to access traditionally significant places or participate in cultural activities. And so I imagine that an HIA on the Dakota Access Pipeline would have been able to potentially look at a number of those things and make the case, maybe not make a case one way or the other, but at least help illustrate some of the impacts that a decision like that would have in so many ways on health and well-being. Bethany, do you have other thoughts on that?
I thought that was a great response, and we didn't have time today to go into depth on inclusion of health and other types of assessment methods, but I think that maybe is a nice segue into saying that HIA can also be integrated into other types of research or community engagement or assessment methods, such as environmental impact assessment and others where health isn't necessarily being considered in that more broader or holistic way. And again, HIA really seeks to broaden that approach beyond access or quality of health care.
Thank you. I just wanted to also at this point put in a plug for our evaluation survey that will be coming out post webinar. You should be receiving that via your emails. But this evaluation does provide us with feedback as well as your satisfaction or evaluation with this webinar and how it has been helpful to you. So we appreciate if you would take a few minutes just to fill that evaluation out once it comes through to you. Also, if you would like access to the presentation slides in order to review in the future, you can download them currently using the Files to pod that's also located at the bottom of your screen. If you just select the presentation and also select I believe it's download, you will be able to save that to your desktop, but we also will be sending the presentation as well as the recording archive to in a follow-up email in the next couple of days so that you can have that.
Thanks, Kimberly. I think with that, we haven't seen additional questions come in. We would certainly be happy to follow up with people who are interested in learning more. Talking with you in more depth about the resources that are out there about HIA, thinking through potential topics. So please don't hesitate to follow up with Amber or I after today to talk more.
And I saw a request come in for the links that we mentioned to resources. Kimberly, is there a way that we could share additional links with you?
Absolutely.
To people? Okay.
Yeah, if you could, and we can work together on that after the webinar to send those out through the follow-up email as well.
Perfect. We will do that then.
So, Kimberly, I would turn it back over to you to wrap up, and I would just say thank you to everyone who joined today. Really appreciate your participation and questions.
Well, I would also like to say thank you again to Amber and Bethany for joining us today from the Pew Charitable Trust to share about health impact assessments and the work that they do through the Health Impact Project. I appreciate everyone that was able to attend the webinar, and we look forward to hearing and seeing you at a future webinar, so please look out for that information. At this point, I think we'll end the webinar and wish you a great rest of the day. Thank you.
Thank you.